Can quercetin be used as a joint health supplement? Would it be wise to take this if you're suffering from joint arthritis, cartilage damage, bone-on-bone joint situations, meniscus tears, or spinal disc injuries? In this video, I'll teach you about quercetin so that you can decide if it's right for you to use this as a health supplement. So where does quercetin come from and what does it do in the body? Well, it comes from vegetables like onions and kale. There's a bunch of other vegetables too. Fruits have quercetin as well, like apples and grapes. And capers are known to have a pretty high concentration of quercetin. It's known to be an anti-inflammatory in the body, so this means that it helps with things like arthritis, bursitis, all the itises, all the inflammatory problems that can happen in the body. This can technically help you out with. But it's probably most commonly used as an allergy supplement because it's known to help out with seasonal allergies. You see, quercetin acts like an anti-inflammatory in the body, so that means that it helps to protect cells against bad stuff that enters your body that can cause damage to your cells. The antioxidant quercetin binds to the free radicals or the bad stuff and helps take it out of the body so that it doesn't end up damaging your cells. This means that it can boost your immunity, and it's even thought to help out with heart problems, diabetes, and even cancer. But let's talk about how quercetin can help out your overall joint health, your musculoskeletal system, all your muscles and bones, nerves, because that's what I specialize in. That's what I'm most concerned about when I'm talking to you guys here. Because quercetin can help fight inflammation and it can fight all the itises, bursitis, tendinitis, arthritis, osteoarthritis, this might give you the edge on helping you set up the stage to heal naturally and be able to avoid surgery. Inflammation happens inside our joints, in our tendons, cartilage, on ligaments, on muscles as a response to injury or overuse problems or other bad forces that end up going through your arms, legs, and all the muscles, joints, and tendons in there. If you can have all the nutrients that your body needs to be able to fend off all the bad stuff, then you're setting yourself up for success. And a nice side effect, a positive side effect, is that this might even actually help you reduce blood pressure, control blood sugar if you're a diabetic. And a nice positive benefit is that this may help you to reduce blood pressure as well as limit the effects of diabetes by helping you control your blood sugar. So there's more than one reason that you should be taking quercetin. Now, what are the possible downsides of this? Well, as with any medication or supplement, you should check with your doctor, make sure that they know what you're taking so that they can tell you if there's any specific interactions with medications you might already be on, like for heart problems. But especially if you're pregnant or nursing, you're worried about your baby, so you need to make sure this is safe for your baby. So check with your baby's pediatrician. Now, the recommended dosage that I've seen from various sources is anywhere from 500 to 1,000 milligrams. Now, the recommended dosage on this bottle here is actually 2,000 milligrams, and I've searched high and low for upper limits of what you can take when it comes to quercetin and haven't found anything conclusive. So that leads me to believe that we really don't know what the maximum amount of quercetin you can take. You're going to be left up to your own to figure out if you're having any side effects from taking quercetin. Now, the most common side effects of taking extra quercetin is nothing serious. They talked about headaches, nausea, and tingling sensations in the arms and legs, which of course, if you have any of those symptoms, just stop taking it and you should be fine. My honest opinion about quercetin is I think it's a fantastic supplement to take, extremely low risk. The downsides are going to be very temporary. As soon as you get any sort of problems with it, just stop taking it and you'll be fine. Toxicity seems to be extremely rare when it comes to this, and the benefits of taking this are extremely high. I mean, why wouldn't you want to set up your joints to be as healthy as possible as part of a plan to make sure that you're taking care of your joint health so that you can avoid surgery and live the best life you possibly can? Taking something like this is quite easy to include in your daily regimen. Now, just do your due diligence and make sure that you test this out. I'm not saying this is going to work for absolutely everyone, and I'm not saying it's going to fix an arthritis problem 100% on its own. This is just a piece of a larger plan. Your best bet is to get some blood work done, figure out where you stand right now, begin taking quercetin on a consistent basis, and then get more blood work done in another month or two to see if it's helping you or hurting you on your blood work. But then you've also got to judge on your own, is this helping you based on how you feel, how you wake up in the morning, how you're able to move, if you're able to do more things. That way you can best determine if quercetin is something that you need to be taking in the long run. And who knows, if you go through an allergy season while you're taking this, maybe you'll see benefits on that end as well. Now let's talk about how to use quercetin if you're going to end up taking this. So you want to take 2 of these capsules or vegetable capsules at a time and take it twice per day. So you're going to take 4 per day total, which will put you at 2,000 milligrams. Now that's what the bottle here recommends. And I think that's in line for what you need to be taking if you're trying to affect your body. And I think that's in line with what you should be taking if you're trying to affect your body's joints. This stuff needs to build up in your bloodstream so that it gets to the cartilage, to the tendons, and begins to have its effect. Now there's 100 vegetable capsules in this bottle here. So you're going to need 2 to 3 bottles in order to make it for 60 days worth of quercetin. Now, just a disclaimer here, I am not being paid or helped out in any way by Solgar. I love Solgar's products though because they really go the extra mile in making sure that their supplements are high quality. They use these amber bottles. It's the same kind of bottles that beer is put into because it blocks light really well to preserve the quality of the vitamins and the supplements. And then they're glass, which I always enjoy over plastic because it doesn't leak bad stuff as much as plastic does, of course. And they go the extra mile in making everything non-GMO, gluten-free, wheat-free, dairy-free, and then they use the vegetable capsules instead of the other synthetic stuff that they make capsules out of. So if you're going to take any sort of supplement, I really like Solgar's supplements so far. Now I need to make sure I tell you that if you've got any sort of osteoarthritis problem, bursitis, tendinitis, those itis problems that affect joints, or if you've got cartilage damage or a torn meniscus or disc injuries in your spine, this alone is not going to cure it. You need to look at the muscle imbalances. You need to make sure you're paying attention to how you're moving, how you're strengthening. You need to have a larger plan that addresses the mechanical component. Now, what this does is sets you up chemically to heal properly. But if you're not addressing the mechanical component, as well as the internal chemical component, then you don't have a full robust plan and you won't get this to work alone. Now, if you're dealing with one of those problems that I mentioned, like a disc problem, meniscus problem, cartilage issue, we've got playlists here on our channel that show you what exercises to do, how to think about moving differently so that you can begin to affect the mechanical problem. I've listed some of those down in the description below, as well as a link to purchase Solgar's quercetin complex here on Amazon. I got this off Amazon. That link will take you to there. Oh, and by the way, I forgot to mention that there's Ester-C in this stuff. And Solgar did that because it's better absorbed by your body along with vitamin C. Ester-C seems to be like their name brand of vitamin C, but it's vitamin C, and you can look at on the label right here. It says vitamin C and calcium, and that vitamin C is what helps to absorb the quercetin better in your body because quercetin alone doesn't go in as easy. It has to be combined with something else. Hey, I hope you learned something in this video today, and maybe you'll start taking quercetin to maximize your joint health. Hey, I hope you liked this video today. If you did, give it a thumbs up, please. And don't forget to share this with somebody that you think needs to learn about quercetin. We make videos with helpful tips, advice, exercises, and stretches for all kinds of conditions. So please share our channel and subscribe if you haven't already. Make sure to turn on that notification bell so that you don't miss out on any of our helpful videos. I'll catch you in the next one. Bye-bye.